Hi everyone, it's Rachel. I hope you're doing really well. I want to let you know that I've missed you all, and I apologize that it has been so long since the last video. So I'm sure most of you are aware that I do dental hygiene services for clients in their homes. Sometimes they're bedbound, and sometimes they just can't leave their home. Sometimes adults with disabilities. I see all different types of individuals with varying needs. Then we also have a dental hygiene practice. And in this dental hygiene practice, this is where I do a majority of my videos. So with this hygiene practice, it has been very busy lately, which is a good thing. So it's hard for me to film videos when there are multiple clients visiting the office. We have a lot of personal subjects that people are talking about, and I can't film that on video. So it's been a bit of a challenge. So I'm trying to figure out the best way to continue my videos in the future. And when I think of something, I will let you know. So this dental hygiene practice has been very busy. There are 3 of us dental hygienists that are sharing space between 2 rooms. So we alternate on days. We also have a med clinic as well, run by a nurse practitioner that has been very successful. They've been running a portion of the office as well. So many times I'll be filming, or I'll try to film, I should say, on these days when they are here. They seem to be here just about every day, except for today, which is great. It is a Sunday that I am filming. And that's not typically a day when people will come in for services. I myself typically never see clients on Sundays. I always reserve this for my family, and I think everyone else does as well. So it's nice to be able to have a day where I can chat and do a video without having to worry about other people coming in and interrupting. So I'm going to be moving things from my drawer filled with dental hygiene related items and moving them into this little container over here. So that way I can leave it off to the side, and whenever I come into the office I can use this. I have one just like this in my own practice that I just got maybe 2 months ago, and I've been using it. It's worked out really well. So I have a rolling train case that I use for clients when I see them in home, and it opens up and it has several drawers. This fits in perfectly in that little drawer system. So I've been using this over the past 2 months, and it has worked out really, really well. And I actually got these from Target, and they were $6, if you can believe it. So, and it's from Bright Room is the name of the company. They actually have a lot of great stuff. So I highly recommend that you look up this company if you're looking for an organization system. It's pretty inexpensive and it works really well. I'll kind of give you a little bit of a up-close view of it in a few minutes. I just finished washing this. I had to make sure it's nice and clean. So now we'll go ahead and show you the drawer system that I have and everything that we're going to be moving over into that. And then also these little trays as well. I have these 2 open trays, bins, plastic bins. So, yeah. So go ahead and follow along with me, and hopefully you can make some good sounds while we're doing it. This is the tour of the office. So just so you can see what it looks like. So this is the front desk. Here. This is the treatment rooms. This is actually for Lefty. One of the other dental hygienists is a lefty. Sometimes we actually have to use this room. It hasn't worked not too bad. It's actually worked really well. Just kind of shuffle things around. This has been my usual room, my normal space. There is the drawers, or the one drawer that we're going to be kind of cleaning out in a little bit. Okay, and yes, this always kind of gets me that there's chocolate right here. This is actually with the medical clinic that's here. So this over here is the med clinic's room. I'm not going to open the door because I don't need to, because that's not my space. I will kind of show you a little bit. I do have a whole section in here. I think this is where patients go in to get checked in. And from here, obviously the lights are out. They have a little IV lounge here, which is super cute. They actually are really professional. They do a great job. And we have a nice little TV there. You can probably see me in the TV. And then down here we have the restroom and all of that. I actually have that turned off right now because there's no one else here at the clinic. Okay, and then here we have our sterilization room. This is pretty much the same as it has been. This is our dirty side, and then we put the items in the sterilization. Then we have a clean side. And this over here is where we put the clean trays, and then we also have a water distiller that we've been using that's been working out really well. And then MedSpanule has got their own little setup here. So Med Clinic has got all of that there. And then here, every time I stop by here, I'm like, oh, it looks like a beautiful sunset to me. But what do you guys think it may be? So this is where we're going to be filming here. So it's going to be here in this drawer. Gonna show you guys. Now, I did not organize this before I came in here. And if you look at this and you think, how is all of this going to fit in here? Then we would both be asking the same questions. So we'll see. We'll see how it goes. So I was hoping that I had some of my pink gloves, but I don't. All I have is the blue gloves here. So I'm going to place these on. Anyways, so I'm gonna go ahead and open this. Okay, I'm gonna go ahead and take out that tray. So if you can see, we've got all of these little bins here, and then we've got this tray. So let's see what we can do with that. So from here on out, I'm just going to be whispering, so that way there's not as much noise. So for these, I'm probably actually going to put these away inside a separate drawer. So I will do those later. I'm going to put these guys over here. Let's see. Actually over here is a little bit better. These are actually bib holders, so it goes on the bib. So I'll kind of show you how it works. So it goes on the bib, and what we do is we're just going to give it a little tug. This way it's not sharp, it's nice and soft, and then we just put it on the sides of the bib and put it on the patient, so that way it doesn't rub. So those are great. I love them, and then we toss them when we're done. Okay, obviously sections. I'm wondering if they'll fit. Yep, they fit in here, so yay. These are actually not mine. These are the offices. So I'm gonna put these ones away. These are actually not my favorite. These kind, if you see, these little things snag the patient's tissue, and I do not like that. I specifically buy these ones so it's nice and soft and it doesn't snag on patients' gingiva. So I'm actually going to put these away. These are just in case I need them. I bought them in the past, so I have them on hand just in case. These ones actually belong to the office, so I will leave that alone. That's gonna go in the trash. That one was outside my little plastic barrier, so wait till the end for those. I'm not sure about that one. These little guys are Relief. So Relief is a great tool that I use to help keep the aerosols down. I like aerosol mitigation, that's what we call it, so it just helps. Sorry about that. So the aerosol mitigation helps to keep the water and air and everything from splashing around. So I have the smaller ones. These are actually for kiddos. Then I'm gonna put the adult ones in here. I actually need to order more of the adult ones. As you can see, I only have a few. I also have covers. These are plastic covers for my suctions and also for my air water syringe tips, which are right here. So I'm going to put these away. Those ones were extra of these little tips that I have. Okay, so I'm gonna fold this in thirds and put this on top. That way I can get to it right away. Now, these little guys, probably gonna have to consolidate a little bit of them. These take up a lot of room. These little tiny things take up a lot of room. I'm gonna try putting them there. With some of these, I may have to like move things around. Some of these I'll probably take home because I have so much of them. Probably could use these at home with my own practice. Then we have some fluoride varnish here. So the fluoride varnish I'm going to be putting in a little container. I actually have a lot more fluoride varnish. All of these. So the gray ones here are marshmallows. The pink ones here are strawberry. Both are very yummy. I think I prefer marshmallow myself, but strawberry is also good. Let's see if we can try to do all of one flavor here. Go back in and get the marshmallow. I do have quite a lot of strawberry. rest of these strawberries. Taking home. There we go. Put marshmallow and strawberry here. We have the gauze. Put the gauze here. I have more room in another bin, so yep. So I will probably put that away for now. And then I have a lot of cotton rolls. Probably going to put some in here. If I was to organize them, they probably would fit better too. But really, who has time for that? I know I don't. Then I have these little guys, and this I'm thinking where to put this. This is called a desiccation gel, and I love these desiccation gels. This actually helps to get rid of diseased tissue, and it kind of dries out the gingiva and makes it so it's nice and light pink, like the tissue was red, and then it kind of dries it out, and it also helps to desiccate the calculus as well, which is like killing off the bacteria, and it helps to soften the calculus so I can remove it easily. Stuff works fabulous, and these are the tips for it. What I do with these, because I like to use it multiple times, I'll actually put these in like a small syringe, like all of these ones here. These are all sterilized, ready to go. So I will open this up, open up the plunger, put in a couple of drops in here, and then normally I will use a different type of tip, and then I toss this and the tip away. It's been working out really well, so that way I can use it multiple times, not just once, because these things are not cheap. Like with anything in today's market, nothing's cheap. Thinking I may know it'd be too hard to get out whether or not I should keep them in a plastic bag. I like to keep everything wrapped up as much as possible. And in some cases, it may not work out. Like I'll open it and it may be really hard to get out, so I'm actually gonna leave it like that. The rest of these fluoride varnishes in here. Right. And then here I have some of the tips I was talking about that I use. So these tips I'll keep over here. This over here is topical, so the topical helps to numb up the tissues. I will see if we can leave it here. I'm probably going to use this one as like a catch-all, probably, since it's so big. And over here, I'm going to go ahead and put my Profi paste in. So these will be extras. I think I'm going to take most of this Profi paste home. Some of this actually is the office's, because I used to use their, oh no, this is mine too. I used to use their trays back in the day, but I don't anymore. I have my own setups, my own things that I bring in, 100% of my own, so I don't share their stuff at all anymore. So, we got there. And these are also the covers that help to keep my polish nice and clean in between patients. So I will be taking some of these home. I've been needing these for my clients at home. Getting low, so I'll probably take some of those. And then leave just a few over here in case I need it at the office. So I'll leave this. I usually bring like a tray with like all my setups in it. So this is just kind of like extra, in case I need it here. If I come in the office and I'm like, oh no, I forgot, a barrier. Oh, I forgot a little brush or, anything like that. That's kind of what this is for. It's not necessarily to be 100% replacement of everything. So keep that in mind. And I will probably leave a few of these here and then probably take the rest home. We're not gonna leave too many, just a few. To have a few on hand here in case you need it. This is, I typically give everyone their own lip balms, so, but I think this is just in case I have like an extra one. So I'll probably leave that one here. This will go in probably the large bin. And then for the rest of this will also go in the bin as well, because this is anesthetic needles. These are anesthetic needles. These are the short tips. These are the long tips. And I have the anesthetic here. This is my anesthetic. These ones are all Citinespline, which does not have any epinephrine in it. So that epinephrine actually really does work really well to help get you numb longer. It helps you to keep that anesthetic in that area that we anesthetized rather than going throughout your body. So epinephrine is actually a good thing to use on a regular basis, but for a lot of my clients, a lot of times they are, they have high blood pressure or they have some sort of underlying conditions where they probably shouldn't be getting epinephrine because it also makes your heart beat very fast. So I don't want to cause any issues with anyone with, fast heart rate. Certainly don't want to cause any heart attacks for anybody with high blood pressure. So typically we'll use the Citinest. I have not had a need to even use any of the other stronger anesthetics recently. Most of the time, honestly, I can just get away with my deep cleanings with using my special little dental pain eraser, which I have in other videos, I believe. And that dental pain eraser works so well, you guys. I can't even tell you how it works. It's fantastic. It blocks the nerve endings from feeling sensitivity. So it works fantastically well. It's almost like magic, I swear. Okay, we're gonna leave those brushes here. Those brushes are for placing on varnish. And then we'll have these. I love to hold on to the bag to keep things, covered up, but I do need to put it away so that way I have extra room. Okay. these are coming home with me. I used to have tops for these, but apparently I don't have them in here. So I have tops at home. We will organize that when we get home. Okay, top on in here. Okay, and there we go for that. So the rest of these things I'm going to be putting in the bins here. So I have these are called Hoopla. This actually is small, which is way too small for most of my patients. These are good ones for children. It just helps to retract the lips. This is what we call the tooth sleuth. So that helps us to be able to find out which teeth are bothering a patient. Usually it tells if there's like a crack in the tooth. It will come up. It works really well. Simple inventions work very well. And they charge a lot of money for like little simple inventions. That's dentistry as a whole. Okay, these are little, it's called Optricky. So these are also retractors as well. I rarely ever use this. This is for polishers. Should never use this. This is a mouth pro. I have extra floss in here in case I have a kiddo that I'm flossing at the end, showing them how to floss with. That is floss sweaters, flossers, and then this is for the dental pain eraser I was talking about earlier. And I have lots of like little extra things. I will probably toss out all of this. Toss out all this. I actually check patients' pH. I don't use these little guys anymore, but now I use like ones that you just put like a strip in. And you can check the patient's saliva, and it tells how acidic their saliva is. Okay, so now for this pin, we will go ahead and place the masks in here. I'll probably get some more masks for later on. I will put the anesthetic and things in here. And then this will be going into another drawer. So it will be hidden. I don't like things to be out and about. I like them either, put under containers or put in places where they're not going to be out in the open. Because I don't want patients to, have anything that would be dirty. So, obviously. This was just like an extra toothpaste I was using for some kids. They don't like to use the paste. So I go, okay, we'll use toothpaste. It's just like toothpaste. And I go, oh, okay, great. Okay, great. So that's going home. There we go. This will be an extra lip balm there. Okay, and then the floss there. Okay. So now this is all ready for the dentist to come in. So if you're wondering what I'm going to do with these, I'm going to put them in my little cabinet over here. I'll finish up over here. I'm just going to take off anything that I think the dentist may not be using. Like, they most likely aren't going to be having relief. And of course they can move these things around. I'm just hoping to make a little bit extra room for the dentist that's coming in. Let's see if we can even get these off. It's probably... Okay, so now we have it all set up for the dentist. So they can come in and, use whatever they need to. I'm going to bring this over a little bit. So that way they can put masks over here. They can put whatever stuff they want, organize it however they like. So I'm going to give that to them. So this is our current setup. Doesn't look super glam or anything, but it's kind of what I'm working with. This is the room that I have right now. That, and then also I have like a little drawer over here too that I put a majority of my like floss and goodies to go away to patients, and also my my little keratin gloves. And yeah, goodies to give away. Eye masks over here, all that good stuff. So that's all in here. The rest of these are the other dental hygienist that's over here. This is her area too. So, but she gave me this little drawer over here, so I figured I'd move all my stuff over to here. So I figure on a regular basis, when I'm not here, all these things, the things I put together, these little bins will be in here. When I am actually here at the office, I will be using my little portable tray and then kind of putting all my stuff in it. So that's what I'm hoping for. So let me go ahead and put it in and I'll show you what it looks like at the end. So that's the final resting place for all my things. Then when I come in, I normally just kind of like bring out, like this goes on the top. I'll keep all these things over here until I need them, and then I will have that area available for the dentist. So I know it's not super fancy over here or anything, but it's something. So okay, that does it for me. I'm gonna wrap up the video. I hope to come up with a new video soon, and we will see when that will be. I hope sooner than later, but just know I do my best to create these videos for you all, and hopefully just seeing a little bit of the background of dentistry, whether you're a dental student, dental hygiene student, give me a thumbs up if you are a dental hygiene student and you're getting a little bit more information about dental hygiene. I can answer any questions that you have, and I hope to speak with you all soon. Please comment. I love your comments and I try to respond to them if I can. Thank you so much